So now, in your case, it is deep so that it goes in your school. COVID-19 is a new strand of virus. It has, or we call it, with many projects sticking in the end spike proteins. And to discuss its pathophys and other sources of data and the pathophysio within all nurses. My question, respiratory disease or a vascular disease, because of a research last that COVID-19 SARS-CoV-2 virus on a cellular level. Since most people believe that it started as respiratory problem, I will focus on this, but involving vascular problems as I go on. Well, you know pretty well that the precipitating factor is SARS-CoV-2, and the predisposing factors are the following. One is poor observance of the preventive measures like poor nutrition, poor hygienic practices, physical and social distancing, the protocol and quarantine, inadequate or maybe misuse of the PPE or what you call the personal protective equipment, or maybe the improper use of mask and shield, face shield, or maybe they do not even use them. Number two, you know pretty well that the older you are, your resistance has already decreased, and all your body systems have also decreased in their functionality. Immunocompromised. Mahirap-hirap ang term. Pero ang gustong sabihin niyan, decreased functionality of your immune system, causing lowered resistance. Number four is comorbidity, COSIO, or sometimes they call this pre-existing conditions. What examples are this? We have diabetes mellitus, cardiac, obstructive lung conditions, abnormalities of the immune system, and of course, cancer. Number five, predisposing factor is when a person keeps traveling. Yan, travel na yan. Because you do not know, it's all right if you take your private transportation. But when you take the airplane, or maybe you take a public transportation, then you will be susceptible of being infected of COVID-19. Another one is if you live in a community wherein there are many cases of COVID-19, you will get the disease. Now, the origin of SARS-CoV-2 is believed to be from bats, mapaniki, and pangolin. Di pa rin ako nakakita ng pangolin. Sa Amerika lang at yung foreign countries ito. And this SARS-CoV-2 is transmitted to human by this bat, or maybe an infected human will transfer it to a susceptible human being. Going into the modes of transmission, the most common is droplets. What do we mean by droplets? Droplets are actually produced when, for example, you cough, you talk, or you sneeze, or even when you sing. Large particles will be brought out or ejected, traveling at least or lesser than 1 meter, which is actually the basis for the distancing imposed now, because they say the distance is supposed to be 6 feet, and the droplet can travel less than 1 meter to be sure that you double. Now, these droplets survive for 12 hours. When these droplets are blown by the air, they now become airborne. And airborne becomes smaller in particles, but they can travel a longer distance of 12 feet. And their survival is 3 to 4 hours. The third mode of transmission is through contact. And when we say contact, this could either be direct or indirect. Direct means to say that there is a person-to-person contact. Well, I need not to give an example, but to me, without malice, kissing, for example, there is a contact, right? So close with each other, or you might be embracing. Now, when you kiss, this is already mucous membrane to mucous membrane, a form of direct transmission. And then when you say indirect contact, this could be through inanimate objects or what we call fomites. yung mga hinihipon ninyo na contaminated na merong SARS, yan ang mga indirect contact. The incubation period of COVID-19 ranges from 4 to 14 days, with an average of 5 to 6 days. The moment the microorganism enters to the body until the onset of the signs and symptoms of the disease. Now, let me now go to my focus, the pathophysiology. I will give an example so that it will be easy. Supposing you are an infected person, you cough, you sneeze, or talk, or I even said sings. A susceptible person gets infected. In what way? Through the mucous membranes of your nose, your mouth, or your eyes. That is the reason why when you use your mask, they will always keep saying, don't touch your mouth, don't touch your nose, don't touch your eyes. Why? Because they have mucous membranes, which are actually the best place that COVID-19 would like to thrive. So when the SARS-CoV is key, and the key is known as spike protein, as they enter into your system, example, mouth, eyes, or nose, they will all be deposited in the throat, or what you call your pharynx. And they stay there for 4 days. After 4 days, they go down to the larynx, travel into the trachea, go into the bronchi, the bronchioles, and the lungs. In the lungs, you have the alveoli, the air sacs. This is actually the target of attack by this COVID-19. In the alveoli, which is the center of attack or the focus of attack, there are 3 cells. And these cells are what you call the alveolar cells. Alveolar dust na parang alikabok of macrophage. Siguro narinig na ninyo ang mga macrophages, a type of or a component of WBC. And this is responsible in engulfing foreign particles in the lungs. And what are these foreign particles? Bacteria, dust, carbon particles, and blood cells. The second alveolar cell is your type 1 pneumocytes, or sometimes they are called type 1 cells. This is responsible in gas exchange. What do we exchange? Anyway, what gases in particular? We inhale, taking in oxygen, and we are supposed to give off or exhale carbon dioxide. And this is supposed to take place in the alveoli. You also know that the normal saturation of these gases will be, for oxygen, it ranges from 95 to 100 millimeter mercury. For carbon dioxide, it is from 35 to 45 millimeter mercury. The third cell of the alveoli is now what you call your type 2 pneumocytes, or type, in producing surfactant, a fatty protein that reduces surface tension in the alveoli in order to prevent the collapse of the lungs, or what we call atelectasis. In the alveoli, this contains a membrane which we call the angiotensin converting enzymes, or in short, they call that ACE-2. The main function of this ACE-2 is when the SARS-CoV-19 comes in contact, they're supposed to bind. This is what the SARS-CoV-2 is trying to look for, because it is only when they bind that the SARS-CoV-2 will be able to replicate. Now, without in contact CE2, the virus cannot replicate. Ang alam niyo, gusto ko sabihin ng replicate, yung mag-multiply, padami, ganyan. Yan ang characteristics ito. There are 3 phases of attack that is used by SARS-CoV-2 in order that they will be able to replicate. First one is viral replication. In a typical infection, virus enters the nucleus by the nucleus, but not in SARS-CoV-2. May special ability to. Why? Because it contains a single-stranded RNA, which is ribosome, a part of a normal cell, will now synthesize the proteins to make it smaller. And inside this cell, you have your acting on the proteins to make them much more smaller. And another enzyme that will be present in there, inside the cell, will be what we call the RNA polymerase that will further transform these proteins, the smaller proteins to the smallest proteins. Malaki palit na palit until such time that sufficient replication is made. These viruses now, many viruses that have been replicated, will clump together and they stay in the membrane of the cell. They all get out of the cell to produce more. And the objective is to infect others. The second phase of attack is pulmonary damage. In pulmonary damage, all the cells are injured. We have the mucus-producing cells and the ciliated cells, which are actually the cells of the lungs. And these type 1 cells, type 2 cells, and the third one belong to the cells in the alveoli. So what happens now when these are damaged? Walang sinasanto ito. Sisirain niya lahat talaga. Let me go to the mucus-producing cells. Since the purpose of these cells in the environment of the lungs a little bit wet, what happens when it is destroyed? It produces the opposite effect. It's destroyed. There will be an ability of these mucus-producing cells to protect the lungs from pathogens. Let me go into the ciliated cells. Itong ciliated cells na ito is actually yung sa loob ng alveoli. Of what? Of debris. So, this is the number of cells in the lungs. They want to destroy the ciliated cells so that more or less nobody will block them. On the alveolar cells, type 1 cells, which is responsible for the gas exchange, will now be changed into an abnormal gas exchange process. Nasira siya eh. So, what happens? There will be a decrease in the oxygen and there will be an increase in the carbon dioxide. When I say increase, that goes beyond a decrease. I mean, less than 95 millimeter mercury. Binigay ko sa inyo kanina ang saturation nila. So magiging less than 95, lalo-lalo na kung naging 93 na, ang oxygen level niya, saturation niya, itakbo mo na sa ospital. Baka lalong mamatay. Saturation, it is supposed to be 35 to 45. What happens here? It goes higher than 45 millimeter mercury. So that means to say that is already an abnormality in the exchange of gases. The inability of the carbon dioxide to be excreted during the process of expiration or exhalation will cause retention of the carbon dioxide in the alveoli. So if carbon dioxide is retained, you expect that the acid-base balance, you have taken the acid-base balance. And what is the most important in the story of acid-base? It is actually the hydrogen ion concentration. So, if there is an increase in the hydrogen ion concentration, changes will affect the respiratory center, which is located at the medulla oblongata. And what are these changes? The factors that will be changed will be on the pH in the blood. You know the normal pH. What is pH? Power of hydrogen. And the normal value is 7.35 to 7.45. In this particular case, there will be a decrease in the pH. So you expect, therefore, that when the pH decreases, the respiratory rate increases. Opposite yan. So yan ngayon ang tinatawag natin na respiratory acid. Alam mo na ang acid. It is an acid when it is below 7.35. It is an alkali if it is beyond 7.45. Diba? You remember that? Okay. Should there be an increase in pH, the respiration will become lowered. Is the partial pressure of carbon dioxide, PCO2. What is the normal value? 35 to 45 millimeter mercury. What happens in the case that there is an acidosis? There will be an elevation of the partial pressure of carbon dioxide, and so they follow in the same direction. So that when the partial pressure of the carbon dioxide will decrease, the respiratory rate will also decrease of oxygen. And I said that the partial pressure of oxygen ranges from 95 to 100 millimeter mercury. Should there be a lowering of the partial pressure of oxygen, you expect that the patient will have increased respiratory rate. And if the partial pressure of oxygen increases of a person. So when you look at the patient now, I mentioned here changes affecting respiratory center. The other effect will be decrease in the surface area in the lungs. If the surface area in the lungs is decreased, you expect, therefore, that there will be a lesser area for the exchange of gases. And so the patient will now manifest signs and symptoms of respiratory acidosis. These are, the patient will be complaining of severe dyspnea. Alam naman ninyo siguro dyspnea, difficulty breathing. And worst is, if the patient will manifest hyperventilation, especially at rest, that is dangerous. The patient will also be disoriented or confused, or maybe signs of abnormal heart rhythm, which we call arrhythmia, can happen. The most common here is tachycardia. When I say tachycardia, fast beating of the rhythm of the heart. All right. You know that the normal respiratory rate ranges from 12 to 20. So if there is hyperventilation, it will be beyond 20. So when you take the respiratory rate of the patient, don't let the patient know that you are taking the respiration, or else you will not get an accurate respiration. May mga pasyente na loko-loko. Either hihinaan nila o kaya bibilisan nila. So what do you do? Parang hindi nila alam. Put your hand on the abdomen of the patient. And the elevation, depression of the abdomen will be the one that will be your basis in counting. I'm telling you what we are supposed to be in nursing care. Although I'm not supposed to discuss nursing care. We go to the third phase of attack. The overreactivity of the immune system. Oh, I have not given you the third, I'm sorry, I've not given you third alveolar cell or cell in the alveoli, which I said is alveolar dust cell. What happens here if there is damage of this cell, alveolar dust cell? This part of the cell will not be able to engulf the foreign particles, and so they remain in the environment, causing further complication on the patient. All right, let me proceed with the third phase of attack, the overreactivity of the immune system. And when we say overactivity of the immune system, the WBC plays an important role in here. Alam naman ninyo na the soldiers of the body are the white blood cells. Okay? So, the overreactivity of the immune system will cause now the production of too much of cytokines. And cytokines, when it is overproduced, what is the purpose of cytokine? It is supposed to control the inflammatory and immune responses. Yan ang main objective niya, cytokines. Very powerful yan. And when there is an excess production of cytokines, you will expect that this will result to a dreadful complication known as cytokine storm. Cytokines will be unable to distinguish self versus non-self proteins and cells. Ito ang one of the functions of the WBC, specifically cytokines. They are the ones who know kung sino ang kanilang kalahi. Alam nila kung sino ang hindi nila kalahi. Sino ang hindi nila kalahi? Yung mga antigens, correct? Yan ang kalaban nila. As much as possible, they do not fight their own cells, type cells. Yung self cells nila. Ang kalaban nila, ang lalabanan nila, yung non-self. proteins and cells. So what happens when there is inability to distinguish the cells, self from non-self, then inflammation would happen. You know that inflammation is actually, to define what an inflammation is, it is an aggressive, immediate reaction of the body, specifically the macrophages, to try to fight the invasion of microorganisms. And this microorganism is actually SARS-CoV-2, and prevent further injury to the cells. Yan ang purpose ng inflammation. Kaya itong macrophages na ito, pag may nangyari, may invasion ng foreign bodies or may injury, maski walang foreign bodies nag-invade, nandyan na yung inflammatory response. Okay? And as a result of inflammation, there will be shifting of fluids. Makikita ninyo na pabalik-balik ako mamaya yan ha. Lahat ng anggulo may ganyan, inflammation, dilatation, fluid shifting. The fluids will shift from inside the blood vessel, which we call intravascular, to the outside, which we call extravascular. Or sometimes you hear the word from plasma to interstitial spaces. Yan kahirapan kasi ng MS na itinuro ko ng 49 years. Yan ang forte ko. Masyadong maraming terminologies na i-memorya mo lang yung terminologies, hilong-hilo ka na. Pero it took me 10 years before I was able to know the different terminologies in MS. I taught it for 49 years. So the shifting of the fluids now will cause thinning and edema of the blood vessels. Naubos yung fluids lumabas sa blood vessel. So ang naiwan na lang doon, yung red blood cells and white blood cells. Wala nang plasma, wala nang tubig, di ba? Okay? And so, if there will be no more fluid in the blood vessel, this RBC and WBC will now clot. They will clot. And when they clot in the blood vessel, the lumen will be clogged. So blood cannot run. Blood cannot run or flow, especially going to the different distal portion of the body, like brain, heart, kidneys, liver, etc. So that when there is no more blood in here, in these areas, you expect that this will now produce what we call systemic inflammation. Systemic inflammation will cause what you call your multiple organ failure. So kung nag-fail na yung organ, ano pang susunod? Death. Okay? I'm now through discussing the three phases of attack. And in here, would you mind putting it up? Okay. I now go into the general happenings that will be in pathophysiology. Of course, we said a while ago that all the cells in the lungs and in the alveoli will die. Okay. And therefore, if they are going to die, they will slow off or be cast off to the airways. Babalik yan. Para makalabas sila. Babalik. Alam mo nang pabalik na yan. From the alveoli of the lungs, then it goes the bronchioles, then goes bronchi, etc. Up palabas na siya. All right? Let me now go on this. The debris and fluids from the damaged cells will happen. In the early stage of COVID-19, SARS-CoV-2 infects the bronchial epithelium. Type 1 pneumocyte or type 2 pneumocyte and the capillary endothelial cells. Type 2 cells or type 2 pneumocytes sustaining an injury will release inflammatory mediators like cytokines. Inflammatory mediator yon. Histamines, interleukin, prostaglandin, vasoacidamines. And because of these inflammatory mediators, this will now activate macrophage type 1, because macrophages are classified also into type 1 macrophage, type 2 macrophage. Ang lumalaban talaga dito para mga soldiers ay type 1 macrophage. Yung type 2 macrophage, yan ang tigalinis at tigasaway sa type 1 kung sumusobra na siya sa kaka-cause ng inflammation. Nakuha nyo, para mga kwento ito eh. Alright. This is now going to activate the macrophage type 1 pneumocyte causing vasodilation. Alam niyo yung vasodilation, siyempre magdadilate ang blood vessel. Vaso means blood vessel. Dilatation, lumuluwang, di ba? Nagko-contract. Vasodilation is a mechanism in order to enhance blood flow to the affected area in the lungs. And as a result of that vasodilatation, there will be increased capillary permeability. Why is there increased capillary permeability? Alam mo yung capillary siya ng blood supply doon sa loob ng lungs eh. Para nag-intertwine lahat sila doon. Yan ang nagpapalitan ng mga dugo, fluids and everything. So you increase the permeability in order, permeability, the capillary will be increased to make it easy for the fluids to go out of the blood vessel. And this is actually brought about by the destruction of the endometrium. Endometrium, no, endothelium, I should say, not metrium, kung na yung uterus na yun. So, endothelium. The increased capillary permeability will now go into fluid shifting in the lungs. And I told you what happens there in that fluid shifting. But in this particular case, there will be inflammation already of interstitial spaces, the alveoli, and the bronchioles, so that the SARS now can multiply in the alveolar spaces. Well, this will only happen if the viruses, the many defenses of the lungs, napakarami ang defenses ng lungs. Ano itong mga defenses na ito? Yung production ng macrophages, yung production against the antigen, the complement fixation and activation, and then most important is the ability to do phagocytosis. Anong gusto sabihin ng phagocytosis? The ability to engulf them, they will destroy them, and in order that they will all be eliminated. I'm referring to the antigens. All right, yan ang function ng WBC. So, kung nag-penetrate na sila, COVID-19, 19, what happens now with WBC? They go into the area of infection so that they will fight also up to the last, causing now what you call capillary leakage and the spread to other areas in the lungs. The fluids collect in and around the alveoli. Ito na yung mga terminal effects niya. If the infection goes into the pleural cavity. Anong pleural cavity? Yung lining ng lungs, di ba? You have the parietal and the visceral pleura. If the infection goes there and settle in between the two, this will now cause what we call empyema. Nasaan na yun? Sa baba siguro. Sa baba nawala na. All right. When the infection goes to the bloodstream, nag-spread na eh, it will cause sepsis. Anong sepsis? Infection. When the fluids will go into the alveolar wall will become thickened. And so when the alveolar wall are thickened, there will be decreased gas exchange. And the abnormality in the gas exchange, since I said oxygen and carbon dioxide, the oxygen will not be able to reach the blood, yan ang tinatawag natin na inadequate blood supply, oxygenated blood that goes into the blood, hypoxemia. Yan ang most typical ng pneumonia, characteristic ng pneumonia. Now, another thing that happens is, in the above portion of this schematic diagram, I place there fibrin, inflammation and infection cause edema, which in turn will stiffen the lungs. And when that lungs is stiffened, nanigas, abnormal gas exchange will come in. So, kunti ang oxygen, marami ang carbon dioxide. Anong nangyari na dito sa decreased vital capacity? Ang gusto sabihin ng decreased vital capacity is the maximum air you inhale. Okay? So magdi-decrease yan. Hindi ka na maka-inhale ng maraming hangin. And what happens? There will be decreased compliance. Anong gusto sabihin yung decreased compliance? Gusto sabihin, there will be changes in the pressure within the lungs or maybe the volume. So now the lungs will collapse, which we call atelectasis. Now, if the lungs will collapse, this will be unable to oxygenate. And so comes now a decrease in the surface tension. That will lead now to decreased or inadequate oxygenated blood that goes into the blood. Okay? Now, I go into the last portion. When all of these things that I have mentioned will end up, no? Yan ang end effects niya na. The uncontrollable inflammation leading to extreme release of cytokines by loss of replication or regulation, I should say, and the release of pro-inflammatory cytokines. This will result to what you call now systemic inflammation. The heart, the liver, and the kidneys. There will be systemic, lagyan lang yan maging systemic ng lahat yan. There will be systemic mediators and increased blood flow into the area in order to prevent further tissue damage. Increase in the vasodilatation, systemic vasodilatation will lead to increased systemic capillary permeability. This is because of the increased blood flow in the area. The result of this will be, there will be what you call systemic fluid shifting due to destruction of alveoli and the blood vessels. The decrease in the blood volume is actually brought about by the increased viscosity. Anong viscosity? Yung kalapot ng dugo in the blood vessel, causing a dreadful complication known as thromboembolism. From the word thrombo, this is a blood clot. Embolism is when the blood clot, this is usually associated with cardiac conditions. When the blood clot now will travel in different parts of the body, you call that embolus, right? Because this person now, because of the system, the tendency of the blood is there will be hypercoagulability, meaning to say, masyadong mabilis ang coagulation. Pag nag-coagulate yung blood, gusto sabihin, nagka-clot na sila, di ba? Hindi na sila magkalag-kalag. And so, wala nang oxygenated blood or wala nang oxygen at blood na dumapon doon sa mga organs na ito, itong apat na yan, heart, brain, liver, and kidneys. This will result to multiple organ failure. Naturally, when you have multiple organ failure, the end will be death. Thank you very much. That ends up my pathophysio. Extend me. Hi po sa inyo. Okay.
Thank you very much, Dr. Aki, with us. Your expertise in pathophysiology's presentation of the pathophysiology, not yet on the concept of medical surgical. However, there are the ones that have been considered comprehensive but simplified and clear present. We will now open the floor for the open forum. Question or post questions in the chat box. Shoot and introduce yourself and address from the chat box. So, ma'am, actually, and I will be showing to you on the screen. So, these are some of the questions that have been pathophysiology. However, discussion, but maybe we could have some address questions, ma'am. So, exposing factors of COVID-19. We could address it again, ma'am. When it comes to pathology, predisposing, am I right, ma'am? When we talk
Correct.
Those
actually, when you say predisposed, so many, can you hear me? The disposing are not the actual. Precipitating is actually the same as spelling yan.
They're the predisposing factors. Those are the factors could be high risk of having the ball population groups.
Tama yan.
Yeah, the high risk. So most probably from that have been primarily identified since the start prioritized in our regulation here in the start. The statistics are increasing on the aspect of the elders. Why they have the high vulnerable group?
Because of their
also related, Dr. Aquino, with the metabounce is very important when it comes to the cells.
What do you mean by metabolic?
Yes, ma'am. For example, ma'am,
Compensatory
because
mechanism
of the physiologic changes that we identify, the cells may have a delay in the compensatory immediate response of the body. Why is it related to that, ma'am?
Retiring, you know, ang katawan pag tumanda ka, lumalaban talaga. So I'm also high risk pati ng katawan ko eh. So gusto reason niya, pag ginawa natin ng aspa, hindi kailangan ng morbidity eh. Itong kasi marami ang kaso diyan. Ang nila na COVID lahat. Kaso ng COVID, ang result ng binago na nila false negative, false positive. Hindi naman yun ang point sa predisposing eh.
Yeah, it's when it comes to the predisposing, so we have considered the end studies. How about for don't see any studies and statistics post-menopausal stage? Hormones are very significant. You have read po ba, ma'am? Any?
This is now gynae, no? Gynae na ito.
Yes.
Actually, have her menopause. So if you have your early menarche period, but if you have first time to menstruate, then yung pa yun, mga siguro abot lang ng 55. It has something to do with that.
Okay. So if it deteriorates, not that system. So I think based from reading my readings, ma'am, and there's still no studies in relation to individuals. And in ma'am, di ba ma'am, at the start we have the LDAs. It evolved with the age group. It's here in the Philippines.
Alam mo ka country yan eh. If you say, sorry, this is how I look at it. Genetic ka na, parang 40, bata pa with the age. Pero definitely yung 60 and above. Yun ang itong mga bata eh. Hindi ko lang kung hindi pa naman, on trial pa lang naman itong mga vaccine. So because I'm already through in my
dating. So is it possible that we consider existing illnesses as precipitating?
This is actually predisposing.
Okay, ma'am. So I may proceed with the number 2, which I tend to know the answer because I have been in that and part of the recovery case. Major complications of COVID-19 is affecting.
Kaya alam mo still, although heart is sa vascular, kaya they are all part of a new consistence if they will but vascular. Hindi pang researchers na ganit yet. People now and everybody ang complications, it can affect heart.
Yeah.
Inflammation can affect. So I'm not going to confirm. Maybe the future respiratory na, but they cannot detect.
Because one of the highlights of the pathophysiology response. And when it comes to the inflammation, one organ itself, because this blood vessels, and we all know that blood vessels are distributed or organ that may basically affect when it comes. So that's why probably.
Yes, because
that's why during the doctor, is it possible mention that tachycardia and possible because I have not known hypertensive signs on my first week of seeing tachycardia. So eventually, I'm concluding that basics and may affect the blood vessels. It may be related to probably the heart.
Is the heart.
Yes.
Do you accept that?
Yes, because guys.
Kaya nga pag tinitin vital signs. Pag tumaas yung process going on. Correct? Yeah. The respiratory rate increases. You trying to go into my deep.
Pertaining to the
secondary to hypoxia. Oxygenated blood na pumupunta si tissues, di ba? A group system, and a group of system is the human being.
And I'm sharing different experience in tachycardia. I'm checking on are usually when episodes of tachycardia is below and reaching 97, 96 when I experience tachycardia. Whenever there are concerns with oxygen, that is eventually in relation to oxygenation. So I will monitor. I may not be what you call this or a month ago, 2 months ago, but again I'm doing when it comes to monitoring.
They call that the COVID syndrome, being infected with COVID, whatever COVID syndrome. Syndrome is a group of
I have mentioned that in our defined structural and functional, and syndromes are under. Okay, ma'am, I may proceed with the number 3.
Why COVID-19? The GITs also, there is in our track.
If you notice, ma'am, hindi lang, so some questions arise, why it affects also the GI, to the GI. Am I right?
Actually, all have ACE-2 or the undetected. See? And GIT meron rin eh. If you try to look at parang pareho yan eh. Ako yung respiratory patient, alam them. Ganyan sana pag to every system because to know the manifestation. So may S.
Yes, ma'am.
Systemic
Yes, ma'am.
inflammation.
I experienced diarrhea, ma'am. One day that I have experienced, possible, ma'am, that my body already compensated problem on diarrhea.
Now, the signs and symptoms not yet definite. Mariresent natin noong October 18.
Yes, ma'am.
Son of common colds. Halos
Yes, ma'am.
pare-pareho sila eh. Will experience diarrhea.
Yes, ma'am. All experiences diarrhea.
Sabi nila, yung
Yeah.
abdominal pain.
Exactly.
Oo, kasi skin nabasa ng all organ dating sa GIT, heart, endocrine, affected ng COVID eh. Meron, for example, or diarrhea, nausea, vomiting, abdominal pain, thromboembolism, mellitus, arrhythmia, left and right, you have elevated, low serum albumin, itis, encephalopathy. Kanya-kanya pero na-affected ng COVID.
Actually, maybe I'm also having during inflammatory process. It's not only the major organs as well, or all organs, if ever, will be processed throughout the body.
Mediators. But in the event of danger, inflammation, nagtutulong. May kanya-kanyang assignment yan eh.
Kaya usually are most common for the respiratory. So that's why I think advance and process brought about by this COVID-19.
Yes, especially.
Question from our faculty. Last two was positive RT-PCR for several from Dr. Agnes Raimundo.
Yung positive. Baka na gusto sabihin hindi nawawala yung
report,
COVID.
Ma'am. That's why of quarantine. When you are ample. That was the early time last year, ma'am. And then, so what would be the significance nun, ma'am?
False negative. Ngayon the one that caused the lowering of cases of consistent, hindi na naggagamot pa
Second
siya.
is, for example, is the body.
If you, kasi when a person is asymptomatic COVID-19, to indicate that she is positive, ikaw a carrier, no. Tahan na eh. So,
for now, since who have not declared any symptoms,
na pinaglalaban ng mga symptomatic symptoms of COVID, so that will say,
that's why it arises, ma'am. That's why symptomatics are infectious. Do asymptomatic,
hindi ko nakuha.
COVID. Kasi di ba we have mild, moderate.
Nilang sinabi na still carry the pero ngayon nagbago eh. Nagbago. Just this way.
Students, let's try with this report.
Nila eh. Even the word conversation, but no, siguro isolated.
Yeah.
Dito sa America, updated. We do not use mask here anymore. It's kailangan nakataklog palagi. Even they say that, hindi pa rin hindi ko ma-fix sa statement that we need to follow.
Yes, ma'am. Ma'am, probably because since we are talking about that, immune system of children are stronger than
adults. Kaysa mga adult.
So, extent that we can clearly present it, ma'am.
Especially in the mas maraming cytokine na napuproduce.
So, it prevents further
is inflammatory eh. Pro-inflammatory yan eh.
So, ma'am, since we've studied also exams, so very basic when it comes to complete that, and probably the differential count, inflammation, the one that will, so if it is significantly
WBC is elevated because this is WBC. Kaya nga makikita mo yung mga to indicate na dinaban yung katawan, hindi may kalaban eh.
Yes, ma'am. Yes, ma'am. Agree with you. So I think those questions were answered. It's very important for all of us to be updated. Sources when it comes to the knowledge and with the wisdom of Dr. Aquino, and when it comes to her expertise in medical, the very supportive children of Dr. Aquino is extended to you and shared to us as community. Thank you very much, Dr. Aquino.
I will support it to the fullest.
Who are somehow for now, some of them are still anxious. Some of them, or any message to them, ma'am, in facing this?
Specifically an MC dynamic din and that your components of your educating the right function effectively. Kaya nga ang speaking engagements, matagal ako na to be exact, pinakamagaling sa akin when it comes to and not only an academician that zone to PNA ludo ako and I'm sure leadership of your team and for
compliment. Thank you so much, ma'am. Actually, ma'am, one are implementing now. It's always number one, collective learning from them, and your mentorship as my mind that I will continue to learn from Dr. Aquino.
Thank you.
And with because we're about to present our College of Nursing awards this certificate of appreciation valuable contribution and sharing of expert pathophysiology of COVID-19, the nursing perspectives, Manila Central University, EDSA, Caloocan Lee as the Dean of the College of Nursing. So thank you very much. I'm also doing it now. Why I am doing it schools, institutions, it's because of your expertise. Thank you very much again on behalf of the Thank you so much. Thank you so much, ma'am. We will be singing our Again, thank you very much to our Dr. Cleopatra Aquino and to our PACOA as we face how to care in Manila Central University, and have a good day. Thank you.